First of all, I'm just so happy you're here.
I am happy to be here. You are just amazing. I just love your energy from the first time we had a conversation. So thank you.
I hope you know that this crush I have on you is very real. And that we are like friends forever.
Yes.
Just so you know that.
Yes.
Like
forever.
really in our like brief knowing of each other, I'm like, I love this woman.
Oh.
And I love what you're doing.
Jacqueline, and well, we're going to be doing this together. So this is a very intimate connection that we'll forever share. Yes.
I know. I can't say that I would be comfortable doing this with just anyone.
Yes.
Because today, as I just told our TikTok listeners, because we're doing this live, we are actually going to be demoing the CO2LIFT V.
Yes.
Which is really, really exciting.
Yes.
So can you just tell us a little bit about it before we start mixing it up and then we leave the room when we put it in?
Okay, so it started with the face, and I guess we'll get into it.
Yeah.
But CO2LIFT V is a carboxy gel for the vulva vagina.
Yes.
It's going to help women feel greater sensation because it's increasing blood flow. It's going to thicken the vulva vaginal skin. It's going to help make you have greater orgasm. It's going to prevent you from having yeast infections. Ooh. So those are some of the benefits that women feel by using it. But this is a doctor-approved system that we're talking about. And while it's just a gel, a painless gel, it's very powerful. Yeah. But it's painless and you get immediate results. And there's a protocol to it. And I know we're going to be talking about it. But I know we just wanted to explain very briefly what it is so that we can do it and then we'll talk in further detail.
It's really exciting because you can do it at home.
Yes.
I've been learning so much about how the skin in our vulva gets basically thinner, just like the skin on our face.
Yeah.
And so this does plump it.
Yes.
And that does make for just better circulation as well as, like you said, better orgasms.
Yes. And then we're going to talk about the benefit to the clitoris because that's that's the vulva, and then you have vagina. So we're going to talk, I think there are 3 steps that to a woman's intimacy. And one is physiological, which we're going to take care of now.
Perfect. Okay. Let's do it. Okay, so we get this. What does it look like?
So this is a 3 count and this is a 5 count. And it has in the treatment, so this kind of got upset.
Good.
It has the big pack and it has a small pack. So what we're going to do today, we're going to mix the big pack and the small pack. So let's take that, Jacqueline.
All right.
And then it comes with a little mixer. All right. And then it comes with an applicator. Right? So we're going to use that here. So we're going to mix it together. So I'm going to take one for myself as well because I'm going to put one in as well. Okay. And the instructions are there on the box.
Very simple.
And we have videos. So if you click the QR code, there's a video. And then there's also, for those who like pictures, there's pictures here.
Oh, I love that. So basically, here's our 2 packets.
Yeah.
We've got the stirrer. And then for the V, this is the...
Right. We call it the applicator. So we're gonna pull it up, pull it up in the syringe, and then we're going to insert it into the vagina. So this is our little pink. Isn't this cute that it matches your outfit?
Like I said, you know you have great guests when your guest brings a bowl to match your outfit.
It's a little bit of a science project.
Okay.
But very simple. So Jacqueline, we're gonna go here. So the big pack first, you open it.
Yeah.
And then you're just going to put it into the bowl.
And what's in that big pack?
So this pack has in the gluconolactone. Well, and I'm going to explain to you how carboxy is formed.
Okay.
It's the gluconolactone mixing with the water in that package, which then mixes with the magnesium carbonate, which forms the CO2.
Wow.
So this has, so that's there.
First of all, that just sounded like very scientific.
The small pack, you want to definitely squeeze it.
Okay.
And then you just open it, tear it, and then you're going to put it in. So,
and what's in that one?
This one here has the second package that we talked about. It has the magnesium carbonate.
Oh, got it.
Yes.
And then those are having a chemical reaction together.
Correct. So this is how it looks.
Oh, yeah, show that.
And then, you're going to smell it?
Yeah.
Tell them how it smells.
Oh my God, it smells nice.
It's fresh. So we always tell not to put scent in our vagina, right? We're always told that.
Yeah.
Well, this is no added scent. This is part of the ingredients. But it just has a fresh smell. And you just want to mix it thoroughly.
Okay, because the molecules are coming together.
Yes. And you just really want to combine them. Yes, so you want to combine it, and then it forms this, like, you see how
it's such a pretty color.
It's a pretty color. Well, it's like inside the vulva.
Yeah, it really is.
Right.
It's such a pretty color. Like, it's like a light peach.
All right, so key thing is you want to bunch it all together.
Bunch it all
together.
All right, show how you're bunching.
Bunching it all together.
Perfect.
Because what you're going to do, I think the hardest part, Jacqueline, is actually putting it inside of the applicator.
Okay. Yeah.
So this applicator, when you get it, is kind of stiff, right? You just kind of loosen it up.
Got it.
And then you put it there, and then I'm going to Just do it very slowly. I'm going to
Okay.
bunch it all together and here, and then I'm going to slowly put it
Pull back.
inside. So you see, a little bit inside,
Yes.
a little bit inside. So this is always a challenging part.
I see.
Putting it in, you know?
Because you're trying not to get the air.
We're trying not to get the air. So you see?
But
Then the last bit, you're going to
Okay.
put on the outside to the perineum, and that's it.
When you say the outside, are we talking about labia majora, labia minora?
The whole vulva area. So the clitoris, you're going to put it all, spread it all on the outside.
Oh.
Right.
Okay.
And then you're going to put it, some people even, they use it in the anus if they have hemorrhoids. You can use
Got
it. That whole area is erectile tissue
Interesting.
underneath the vaginal opening right up until the anus. That is all erectile tissue. It has sensitivity. So you want to definitely put the CO2 lift there as well.
Wow.
So that's yours, Jacqueline.
Okay,
So
great.
you see we got in a lot of it in there, and some
did.
But what she's going to do, she's going to insert this.
Yep.
She's going to put, you're going to put some more, and then
some
you're going
more.
to put the rest on the labia.
Rest on the labia.
We brought panty liners here.
Oh,
So that you're
great.
going to put it on,
Yep.
and then we're going to come back and sit down.
We will be right back.
Right back.
I'm so excited to do this. Okay.
Okay.
So it feels really nice. It feels like like a gel.
It's cool, right?
Yeah, it's
It's
cool.
cool. So it's kind of it's a gel. So feel like I'm trying to think. If you think of like an ultrasound gel, when you're getting an ultrasound, that feeling on your stomach, it's the same feeling, but it's internal,
Yes.
right? So it's very cooling inside. So for instance, for anyone who has a burning vagina, this is it's very soothing.
That's a great point. So it doesn't sting, and it's not like sometimes if you put like something on with a little bit of acid, it can like make it a little bit red or a little stingy. Like I put some skin cream on at night and it's like, ooh, a little stingy. Not at all. Like you said, it's really soothing.
Yeah.
So like upon the insertion, it was just kind of like, oh, that's nice.
Yeah. Yeah.
Like, nothing weird. It didn't feel weird. It just felt like, okay.
Now, what I'll tell you that some women will experience maybe a little bit of, they feel like a heat. The heat is just it's blood flow. So
Yeah.
it's not the product. The product is very cooling. When you're sitting down, and you may feel it when we're together here, you'll feel something going on because action is taking place. Because what happens when you put CO2 gas into the skin, the body automatically responds by pushing blood, oxygen-rich blood, to the area that is applied. And so you're going to may feel some sensations down there, and nothing is
Yeah.
wrong with that. It's a very relaxing experience. I've heard some women express that they almost feel orgasmic. I've never felt that way, to be honest, but I can
Yeah.
understand if people maybe have never felt something in a long time down there. Maybe they feel that
Sure.
way, but I was surprised that. But what I'm trying to make you understand that it's a nice experience. There's no pain involved. And when we finish this, which is 45 minutes after, you could have sex if you wanted to. You know,
Like no downtime.
there's no downtime. Also, too, you don't have to do it in the day. I like to do it at night. So when you're going to bed and you're ready to sleep, you mix it, put it in, put on a panty liner, go to sleep, and wake up in the morning. If you happen to pee in the middle of the night, it's no problem. Your muscles are going to relax and the gel is going to fall out into the toilet. But remember, after 45 minutes, all the CO2 is out.
Yeah.
So then it doesn't matter. But so it can fall out. You wipe it off, put on another panty liner, and you're good to go.
Is it becoming solidified in any way?
Yes, it's forming
It
like
is.
a gel. So even when you do it on the face, and yesterday in New York, we were at BTS. It's a meeting, Beauty Through Science. We were with a lot of plastic surgeons, dermatologists. They did it. We did it for them. And
Yeah.
they're sitting up, so not lying down. And you put it on their face, and it stays. It doesn't drip off.
Yeah.
So about 5 minutes, it gels a little. They walked around with it on, and then you can take it off. Ideally, when you do it, you want to lie down and relax and
Sure.
have it so that it doesn't fall, because it goes right up to the lash line. Now, we're talking
Wow.
about the application for the face. We weren't doing these yesterday, although we could have, and we have done that.
Is it the same formula?
Great question. So the carboxy is the same, but it's a slightly different formulation. The pH is 4.5, whereas for the face is about 5. So it's a little different. And then we also have something in there that's going to address inflammation or inflammatory conditions that a woman may experience. So it's that's a slightly different. But when we did, in fact, think about this. When we did the first clinical, we didn't have the V yet, because when we were doing just the test, we had to use that. So it was effective. And then when we did the larger study, which we replicated, that was done with a different formulation.
Interesting. So this is like basically you're talking about the study that you did for the carboxy, and that
so let's talk about how we got into it, Jacqueline, if that's okay with you.
Yeah, and this one, like this one here is for face, eyes, neck, body.
Right.
Yeah.
So
whereas this is the V.
This is just the vulva.
Yeah.
And this is also used for the penis. And we'll talk about that too. So when we started, so this was in 2015, we started.
Okay.
We discovered carboxytherapy. We're doing research to find something very different to bring to the market for skin that's going to be effective.
Yeah.
And so did research, and the only delivery system that we saw at that time was a needle. So you would go, and in Europe, you could go South America, and they would just get a tank of CO2 gas, and then they would put it into your skin, and it actually regenerates the skin very quickly. It's very similar to a hyperbaric oxygen chamber, in the sense that once you put CO2 gas into the skin, it triggers a series of events that regenerates the skin very quickly, okay?
Interesting.
In fact, I'll tell you, we can close a non-healing diabetic ulcer in as little as 8 days. So I was excited about the idea of carboxy, but we wanted another way that was not invasive, because with the needles, there's pain involved. You have to go to a doctor's office. There's some downtime, and there could be complications. So we just researched, and we found a group of scientists in Japan that actually patented the technology for CO2 through the skin. Now we have the exclusive rights to that technology, but that's how we started. And before we launched, we did our first clinical, and it showed that the CO2LIFT it was very hydrating. So you're talking about 117% increase in hydration after only one application. Now, I'll tell you, that is a big number. And I mean, I often compare, the hydration to a grape and a raisin analogy. We're all born this beautiful grape, and then we turn into this raisin. And what's the difference between a grape and a raisin? It's hydration. It's water. A grape is full of water. A raisin is a dehydrated grape. So we thankfully have the technology that slows that process down, and that happens all over our body. So hydration is a big point. So we started, and then we had a very interesting experience. We had a doctor who was the godfather of carboxy. That's what they call him, Dr. Gustavo Leibeshoff. And he was at a meeting that one of our physicians were talking about this, and he was very upset. He was very upset because he said, this is impossible. He's from Argentina. Impossible. How is it that you can have carbon dioxide through a gel? I don't believe it. So, of course, my stomach is in anxiety because I'm like, what do I ask? So I went and I introduced myself, and I said, listen, Dr. Leibeshoff, and I did a little research, and I understand why he was so passionate about it. And I said, I understand your skepticism. What can we do to show you? So he said, well, let me see it. So we gave him the product. And basically what he did is almost like a biopsy under the skin. He used a video capillaroscopy, measured what is going on in the skin, compared it with the injectable, and it's the same thing. The capillaries increase the same way. We get the same results. So he was very happy. He apologized, and then we started working together, because now to have he understands the power of carboxytherapy, and now to have a form that someone can do at home.
Exactly.
Someone can do with no pain. There's no complications. So we launched in the face, and we're getting traction, and we get really great results. We've done pre and post surgery. We've done pre and post procedures, and because what it is, it heals the skin. It's bringing your own growth factors, own exosomes. Then, when we did a diabetic ulcer study, this kind of triggered this application, the V. The diabetic ulcers, as you know, diabetics, one of the problems is blood flow and circulation. So usually on their extremities, their wounds can't close. So we did in our test, we did a test to see how does this work with wounds, and we found that it closed a 6-month non-healing wound in 8 days. So we did a larger study
Wow.
with 15 patients, and again, severe wounds, and they closed within a month. So then I'll tell you how we got to the V.
Okay.
So then fast forward, I became 47, and I started, noticing a difference in the quality of my own sex life. And I was really very conscious of this because I remember one of the things my mother told me when I got married, and I'm celebrating 26 years this year. She said to me, to stay married, you want to give your husband sex every day and feed him every day. And I did that.
Okay.
But then when I got into my 30s, I noticed that I wasn't feeling. It was a chore. I interpreted it to mean that sex is for him, right?
Yes.
And so it was like, I have children, I have a business. It's like, okay. It was just like, Lord have mercy. So I was telling Mommy, I don't know if this is as fun as it's supposed to be, because I was looking at it more as a performance type of thing. And Mommy said something to me which actually changed my life. She said to me, good sex is like playing tennis. It's just a different set of balls. Focus on hitting the ball.
I love your mom so much.
I don't know.
That's so good. It's just a different set of balls.
It's just a different set. So if you think about, what I pictured in my mind was Serena Williams, and she sees a tennis ball. She doesn't care how her face looks. Her whole focus is connecting her racket with that ball.
Yeah.
And I understood what Mommy meant. It was about sex, was about connection. It was about being present. It's about being focused on that moment. And then I looked into the benefits of really what sex is to me.
Yeah.
So then my sex life changed. And I started my hormones in my 40s, but still when I was 47, I started hormones at around 45. Okay. 47, I noticed a difference in the sensitivity. So I couldn't feel my husband in the same way. It was like,
that's what everyone says.
Yeah, it's like, are you there? Like, are you shrinking? Like, what's going on?
What's happening?
So I went to my GYN, and then she explained to me what happens to tissue. So she explained to me that, the clitoris needs regular blood flow. Yeah. Blood flow starts slowing down for many reasons. Aging, from the age of 25, it starts slowing down. And if we do nothing to treat, or cancer can slow it down, blood flow, if we do nothing to treat it, it becomes smaller. It kind of shrinks. It's like, think about, a man having sex with a flaccid penis. Yeah. It's not that enjoyable to him. So a lot of women are having sex with a flaccid clitoris. And we'll kind of go into, so they're not really, there's no really sensation,
That's a great image, because most of our clitoris, as I think most of our listeners know, is inside our body. So we actually get an erection, but we can't see it.
Right.
Most of it's below our surface. Right. So that's such a great point. And Dr. Marashi was just on a couple weeks ago, and he explained this. He was like, okay, so if this opening here is your vagina, if this skin that's like here and here gets thinner, then it's wider, right? So you don't feel them in the same way, because that skin is getting wider.
It's feeling flat, looser too. Yeah. So the clitoris is one thing, and then and I know we're going kind of all over the place, but I want to make this point. We're born, all sexes, we're born with a clitoris, right? Yeah. And when in our mother's tummy, when it decides that it's a boy, it turns into a penis, so it comes outside the stomach. But inside the clitoris is the penis inside. So it's important that, and you look how men celebrate their penis. We as women should celebrate our clitoris, right? It has over 8,000 nerve endings. Anyway, so she explained that, and she explained what you said in terms of the thinner skin, so you can get drier, and just sex can be painful. So that made me kind of think about what we have already. Blood flow is the issue. If we can address blood flow, we can build back tissue very quickly. Why wouldn't this be a great application for our vulva vagina? So I went to at the time we had one, Dr. Labashoff, who is a cosmetic gynecologist, and I said, what do you think about using it there? Yeah. So we did a pilot study just for proof of concept. Sure. We used, so there's double blind. So, of course, that means that the women don't know what they're using, and even the investigator who is looking at the information, they're not aware of what is happening, if it's a placebo, the ultrasound gel, or the CO2LIFT technology. And all the women that used the ultrasound gel showed no changes in sexual function. Okay. All the women that use the CO2LIFT technology showed significant changes in all areas. And we were pretty excited about that. And then we saw the biopsies. And when you look at 10 treatments in, so the women got 10 treatments, 5, they took the break on the weekend, 5 more. And when they measured it 10 days later, that tissue looked like these women, they weren't in atrophy. I mean, it looked like healthy, vibrant, 30-year-old tissue. So again, that was really, so I went back to my mom and I just told her before we launched, when I got the results, I was like, this is really great. I said, Mommy, what do you think? I said, first of all, what is your sex life like? And she explained to me, and at the time she's in her 70s, so she was around 73 at the time. And she says, it's very painful. It's like sandpaper. So when she did the treatments, 10 treatments later, it went from sandpaper to butter. Not only for her, my aunts. So I was just pretty excited, and then I said, we have something. So we replicated the study. That was published in 2020, and now we're in the process of doing another IRB study. So what's the difference with the Pro? So because we have a Pro formulation, because when we launched, we actually started with the Pro, which is only doctors' offices, and then we launched the direct-to-consumer. So the direct-to-consumer is not as concentrated. It doesn't have the lightening agent. We wanted to have something that was similar but a little different from what a professional would have. So it's effective, but obviously, I mean, I think the Pro version is going to, it's better. You can use both. In other words, for carboxytherapy too, where the key ingredient is the carboxytherapy, which is in both. But the Pro has other things that are helping the skin in other areas.
All right, so lightening.
Lightening is.
And what else?
It's really the lightening factor.
It's really the lightening factor.
Yes.
So that's for basically hyperpigmentation?
Brighter, lighter skin.
Brighter, lighter skin.
Yes.
And could we self-administer that at home? The stronger.
Yes, the doctors sell it to you. So we sell it for around the same price that a doctor would. So we don't compete with our doctors in that way. So you can go. The doctors not only will do it, they only really do the CO2 lift in the office if they're doing it with a procedure. If they're prepping your skin for a procedure, they'll use it. Okay. But most times they're going to give you to do it at home.
Okay, so if I go to my let's say dermatologist, or plastic surgeon, and I'm like, I want to buy this from you, it's going to be a different formulation than what we're looking at right here.
Not the V. The V is the same thing.
V is the same.
The V is the same. It's this one, the face. What we use on the face, the body, and the hands.
And so I'm assuming there's a price difference between the Pro and the...
Maybe in some doctors there's a little bit more, but it's around the same price point.
Okay.
Yeah.
Okay. What is the price point, just for
this?
Who don't
for
know?
The mask, it's $93 to $100. On our website, you'll see it for $93. I mean, a doctor may upcharge a little depending on other things that they're doing. But if they're giving you to do it at home, it's around $93 for one single application. So you have a single and you have a 3 count is how we kind of sell it.
Okay. And how about for the 5V?
The 5 is, doctor's offices sell this a little cheaper than on our website. It's about $550 at a doctor's office for 5 treatments. And $600 on our website. It has no expiration. As long as once you mix it, you have to use it immediately. You can't even put it down a little. You have to actually put it in immediately.
Right. So this that's been sitting here since we've been talking, no longer effective.
No.
However, when someone asked how it felt, and I put a little on my hand, that has now dried a little bit, as you can probably see. That was probably effective.
Yes. In fact, let me do this for you.
Because that will probably peel off.
That will peel off. Jacqueline, can I put one on your hand?
Yeah, of course.
Just to show people. So this is the packets for the face. Now you can use this on the face, the neck, the hands.
Neck.
And I use it on my face and my neck.
Yeah.
One of the things I always thought, my hands, and I'm doing a steroid cream on my hands because I have vitiligo. So my hands are getting thinner. And why am I not using it on my hands? I think the problem for me is that I like to move my hands around. So I said, why don't we put on gloves? So actually next year we're going to be putting the providers for them to have gloves.
Perfect.
So they can put it on. So I'm going to mix it for you really quick. And I'm going to put this on your hands.
Okay.
And then with the gloves on, you can go on your computer, on your laptop. There's no mess. But you're going to see a big it's definitely helping your skin. We did a hand study.
Color. I love the color. My kitchen used to be painted that color. It's like perfect. It's like a peachy pink.
Yes.
So pretty.
Yes.
So pretty.
So it's a very simple thing. I really encourage people to do the series first. Which means on the face, that means 6. You want to do 3 the first week, and then you can do 1 a week. And in our study that we did, it shows 26% increase in elasticity after only 6 applications. That's very big, 26% increase in elasticity. So, and then you do it once a month to maintain. Now, I do it every 2 weeks. I do my face, my neck, and I'm starting my hands now. And then for my vulva vagina, I do that once a month.
Once a month.
Once a month
Okay.
for that.
All right.
And you want 10. So you want a box of 5, so 5, and we have the box of 3. You want to try and do 10 as a loading dose. For anyone who has not ever done anything for their vulva, 10 is really the magic.
Once a week?
Every night for 5 days and then 5 days. So 5 days, take the weekend off, 5 more days. So 10 treatments, and then you do once a month. It will change your life. And you know, I was showing you the testimonial of that cancer survivor. So let me get your hand. So look at her hands. Look at her hand. Take this ring off so I can put it on.
So here we go.
I don't know if you can see it, and then you'll see it after.
All right.
This is actually, and this is a great treatment for, especially coming off the plane for your face. So tonight you have another one.
It does feel so nice.
It's a nice
It's really
treatment.
like lovely. It's cool.
Okay, I'm gonna
Oh
put
my
it a
God,
little
it's
bit up.
so fun.
You're going to put your
Feels
hand
good.
in
Feels
here.
really good.
Now, it's a lot I'm putting on her hand because when I do my hands, so try and space your fingers. You can open your fingers. It doesn't matter if it forms, if it kind of slides around. No, on this one, I know your hands are so tiny. These bags.
Oh, got it.
I'm putting. Just put it in.
I see.
Just so that you have your hand.
We got this.
Yeah. All right. So there. Right.
Okay.
That's one.
Okay.
And then I'll do. Now, when I do my hands, this is going to be enough, more than enough for the hands. This is going to be. I usually do the hands and the décolletage in this one. So this gives me enough for that, you know? And you can do another part because you can see I'm putting a lot on her hands. She really doesn't need that much, but we're not going to do our face in here, and I don't want to waste the product.
I know.
So
I basically want this to become like body size,
Yes,
and I'd like to sleep in it.
I know.
And zip it up and just have little breathing holes. It's so nice. It really does feel good.
It's a nice treatment. Really, it is.
I like it.
You know,
I'm already hooked.
We're talking about self-care and
Plus, this is like an in-office procedure.
yeah. But you're doing it. You can do it for yourself at home. I'll just do.
Okay, so we got it on the hands.
I'm just going to do.
Yeah,
the
and
rest.
now we can go onto the computer. I just
And
scratched my
scratch
face.
it, you can.
Right?
And Jacqueline, I don't know if I told you, we're putting a discount code for your
Yay!
For your listeners and your audience, so they can be able to get it, and
Okay.
the 15% off
Oh
the
my
whole
God.
site.
Okay, so we will put that on our link in bio.
Yes, that's it.
Okay.
And we're
Got it?
We're ready. Okay. Okay. So that was it. But so to talk, so again, the vaginal, and I know clitorology.
Yeah.
By the way, Jacqueline, I just love your platform, really focusing on this area of a woman, because I think that we just don't have enough of these conversations, just as you say in your opening and so on. So with the V, it's something that it changes people's lives. We're saving relationships because intimacy
true.
has, benefits. And when we say intimacy, I mean intimacy includes, sexual intercourse. Intimacy is not only just sexual
not.
intercourse, but sexual. A lot of women are afraid of intimacy because they're afraid it leads to sex. They're like, oh, if I start
And if it doesn't feel good.
and if it doesn't feel good, they don't want to do it.
Yeah.
So this is something that it's really life-changing, and oftentimes people ask me, well, when should you start something like this?
Yeah.
When should you start? Well, when do you start taking care of the skin on your face? We look at other countries like in Asia, and they look young for a very long time, and you wonder what's the difference. The thing is that they start from 15. Mm-hmm.
That's true.
We start later on. I think this generation has definitely changing.
Oh, yeah.
The baby Botox and they're starting to skincare early. So I think they should consider that skin because, again, what are the things we talked about? The clitoris needs regular blood flow. When does that start to slow down? Around the same age, 25. So if I had a daughter and I have 2 boys, I would start, first of all, I would be talking to her about these things, and I would want her to start looking at that around that time, doing maybe not the 10, maybe a 5 to kind of get up to speed, and then just once a month. I think it's important to keep that at a slow simmer, to keep that, and then when we're ready to turn up that heat, then we're ready to, it doesn't take us as long to warm up.
Yes. Okay, I like that.
Because blood flow, for a woman, we need time to get engorged. We need time for the blood to rush there. So it can take, and as we get older, that can take a longer time for so many women. So why don't help us to keep at that simmer so that when we're ready, it's not, we still need warming up, but at least it's quicker,
Yeah, it's interesting. So when you were telling your story about how your sex life changed.
Yes.
And then you said, so you started the hormones, but that didn't change everything.
Yeah.
Right? I mean, there's no kind of one magic pill, but you were, addressing that. But then when you started to do the V, is that what changed it?
Yes, because again, hormones are great. And I'm a big advocate of that. I think women should start testing their hormones from the age that they're 35, just to kind of get a baseline to see where they're at.
Yeah.
But I mean, and then even look at maybe testosterone, it helps with the libido.
Yeah.
But it's not addressing, none of those things are really addressing blood flow. Even estrogen helps, and you have estrogen creams that help, but really blood flow, what is addressing that?
Yeah.
Well, this is, you're thinking about closing a diabetic ulcer wound in 8 days. That's blood flow. And it doesn't stop. So it's not it's not a lube. So it's not something that you have to apply every time you have sex. You basically turn it up. I'm going to tell you about men and how we're helping men, because that will kind of give you an understanding. So we have some practices that are using this for men for erectile dysfunction.
Now, are they using the V or the face?
The face.
Okay.
Right? So they don't need the pH change, and they need more coverage, hopefully.
Got it, because it's on the external.
Yes. Hopefully, if they're using it on there, they would need 2 packets of the V. But the average size man is going to need a packet of the regular.
Yeah.
And they're using it, and they put it on their testicles. And what these doctors are showing, an increase in the SHIM score of 5 to 12 points. So, the SHIM score measures sexual function for a man. Like, I don't know the exact numbers, but like say 1 to 5 means mild to moderate ED, and then 6 to 10 means, and I should be abreast of the numbers, but that's not our focus.
Okay.
But they're saying that you can get 5 to 12 points by using 5 CO2 lifts, and then a man would have to maybe repeat this in 6 to 8 months. So think about that. So you had 5 treatments, just like the woman, the first week, and then after that, they're getting stronger morning erections. They're getting smoother skin. They're getting more sensitive skin.
Yeah.
So even we have this great testimony. I'll share this with you after, so you can do what you want with it. But he's telling just touching himself he likes, because he's just more sensitive. He's getting more erections. He's getting his girlfriend so it's
interesting.
So it's something. Blood flow is so important, and this is one of the things that addressing blood flow, and that will help with lubrication. So some women may have a lubrication problem. When I had gone to my gynecologist, she said, Lana, you don't have a lubrication problem.
Yeah.
Well, guess what? Okay, I may not have had a problem, but it wasn't back to when I was in my 20s.
Sure.
Now it's like open the floodgates of heaven. It's like it's even on my underwear. You know how when you get older, and I don't know if you experience this, but a lot of women that I speak with, eventually you don't get that little discharge, was healthy discharge on your underwear. Well, mine, I'm 53, mine is back. I mean, so you feel young again, and I'm in menopause. So I was in a room full of women, and we were talking about, you're going to get a better sex life. No one was excited. I mean, these women were all menopausal, and they were like, I could hear crickets, and I'm like, until I said, but guess what? And this also, what women find is that once you use it, you can cough and not pee. No, you saw the excitement. You know what I'm saying? And I understand that's quality of life too.
Sure.
But just think about it. They were more excited about coughing and not peeing. Because
that desire had gone.
It wasn't. So this is something that if you care about that part of your life, which we all should.
Yeah.
Start before you need to reverse things.
Exactly.
So.
Right. Basically, use it as a preventative.
Yes.
Rather than waiting until there's no desire there. And then, like in your case, where it felt like a chore, where sex felt like a chore.
Yes.
I love how simple it is to make. And even though you told me, okay, you do this, this was really helpful to actually just to see it and do it, to just go, oh, okay, now I know. All right.
Yeah.
And now you know to basically to insert using this, like that little trick.
Yes.
That's helpful, because sometimes when you buy something and you get it home and you're like, wait, what if I'm not doing it right?
Yes.
And then you kind of question, well, wait, maybe I'm not going to get the results because maybe I didn't do it right. So I'm really happy we basically have gone to this length to get there. Yes. And to the length where we left the room, inserted it, and it's still there.
Yeah.
So they feel like a little warmer, and sure, they're covered in plastic. But I can feel like the warmth like at my skin. And I feel that because normally I have really cold hands 99% of the time. So I'm just aware, and that's the circulation, because then actually if I went and ran around this office real quick, my hands would be less cold, or if I did some yoga, which is great for circulation, then my hands wouldn't be as cold. But this is clearly bringing the circulation.
That's interesting. Yeah. Yes.
And that's what slows down as we get older.
Yes.
It's basically less circulation. No joke, I wear little glovies at my desk. And then the best thing though, and then I hold a hot mug of, even if I'm not drinking it, I hold like a hot mug of anything. But then really, it's getting up and doing some movement, that's for sure.
Yeah.
Or doing this.
Yeah.
Or just typing while you're in gloved hands all day long.
The hands are something I think we also ignore. I mean, in terms of aging, you can look good on the face. People ignore the face, and people ignore the neck. So their face looks good. The neck, you're like, I can tell they're not as young as they look.
Oh, yeah.
And then the hands are sure giveaway.
Hands are the giveaway.
Sure hands. And you know what a gynecologist once said to me? That a true age of a woman can be seen in her vagina. Isn't that?
Ooh, I like that.
Because
my vagina feels young. Yeah. I think that's why I like it so much.
Yes. Well, and then you're taking care of it, Jacqueline. I mean, you're conscious about taking care of it. You're talking about, clitoris, and you're talking about it, so attention and focus is being made. But so many women discard it. So many women, like myself, I didn't even look at my vagina, my vulva, until I was in my 30s. So when you don't think about it, you're not caring for it, then it gets older, and then if you're not doing anything inside with the tissue, it's going to show age because it's thinner. So you're going to feel it eventually.
Correct me if I'm wrong, but are there any other treatments that are addressing the inside that is a gel, not a laser? Because there are lasers, right? Like there's the MFEM 360.
Yes.
That goes inside. And there's others.
Yes. The Morpheus V.
Yes.
Empower platform.
There you go.
Yes.
Yep, that one that's like an egg that goes inside. It actually goes inside, right, rather than like the Amcella that you're sitting on.
It's inside, and I've done the more. So we work on the face with a lot of providers who do Morpheus. So one of the things is the challenges I think that goes with Morpheus is it's the comfort level. It's not a comfortable treatment per se, right? So there's a benefit of pre-treating tissue before you use radio frequency, right? Before you use energy on it.
Yeah.
And remember, we talked about how the hydration increases significantly. So it's when that device is always looking for water. Anyway, so you pre-treat the skin before you do a procedure, you're going to get a much better result. One of our physicians, her name is Tess Mauricio, in fact, she really gave us this idea. She knew the benefit of pre-treating, but then she didn't have time to have the patient 45 minutes and then wait for the 45 minutes for the numbing cream. So she says, I'm just going to put the CO2LIFT on top of the numbing cream.
Yeah.
So not only did she pre-treat the skin, but what happened, she found that the patient was like, this is comfortable. It's not as painful as last time. We actually did another study with another doctor, Dr. Chilikuri, and he did ultrasound and a split face, ultrasound, and then the CO2LIFT. And the side with the CO2LIFT had 100% less pain than the side with just ultrasound gel, and the patient didn't know which one was which they were using, and so it really does make a comfortable treatment.
Interesting.
So this doctor who's been doing that said, how would it work with the Morpheus V? She was one of the early doctors, Dr. Jen Owen. She had the platform. She was given that platform to see how it worked with women. So she tried the CO2LIFT V with it. So what she did, she put the numbing cream on inside, then put the CO2LIFT V, and left it. And what she found, and the patients found, and she did it on herself, is the discomfort was, but after the healing time was, or the down time was different. It was shorter. So she was getting success, and she's like, Lana, I think you need to try this. So that when I'm inviting my trainer to see this being done. Yeah. So I did, and I tried it. And what I felt like maybe 3 stapler pricks. Maybe that's what I felt.
Okay.
But it could have been more. Like the CO2V helped it. So that what they were impressed with was that they gave me, I think it was like 995 pulses on my clitoris and in the inside, and there was no swelling.
Really?
There was no swelling. I mean, I could have ridden a horse the next day. Okay. So I mean, so then she put a treatment inside, and then I went home with it, and then I did another one the next day. So that was I think that if you use a device, this is great in combination therapy. So devices work. I think combination therapy is even better. Yeah. If someone was doing one, I'm going to say the CO2LIFT V. If you're going to just do one, you're going to get all of the same things with no pain.
That's pretty incredible. Well, and talking about healing, you shared some photos.
Yes.
Where this technology, and I'm going to call it technology because it really is it is chemistry coming together. And even though this is slightly different, right, the V is slightly different than for the face, it's generally the same principle.
Yes.
And you can use it for so many other things. Psoriasis.
Yes.
Wound healing. And I just have to pull this up here because it's really compelling. I mean, these before and afters are nuts.
Yeah.
And you said that surgeons are now putting it right after. So if I was going to go get a facelift, I could say, I'd like you to put this on immediately after, like before I go home.
Correct. So the physician will probably say, I don't know anything about it if they didn't, and then we would show them what other physicians and very well-respected plastic surgeons are doing. They're using it on the breasts. When you get a breast lift, they're using it. Dr. Hoyos, Alfredo Hoyos, I think he is one of the most respected physicians, plastic surgeons, and he did an incredible study with the CO2LIFT because it's as I said, it's compared to hyperbaric oxygen chamber.
Right.
So on aggressive surgery, they're using it, and I mean the results were very impressive. He did split body.
Yeah.
So he did 50 patients, split body, the only one side, and the other side, of course, nothing. And you're talking about healing in a quarter of the time. So it's a great thing for healing, for skin regeneration, for again, just for skin health.
Yeah.
There's so many things that are out there that compete with our attention. I think the carboxytherapy is a new category in skincare, but it really is the fastest way to better skin. The exosomes are getting a big hype. Well, the CO2LIFT is bringing your own exosomes and growth factors to the area.
That's what I really love about it. Because I think exosomes are amazing. But then to have your own, that's the ideal.
Right. Exosomes are amazing if you know if they're really exosomes, where they're coming from. I mean, so that's always a minefield there.
It's a little bit of a minefield.
So who are we? So
where are they coming from?
Exactly. So again, I'm not knocking exosomes. Many of our providers use it and love it.
Sure.
And but I think that if you're looking for a one-stop shop, if you're looking for something, I always use this analogy. You're going to Japan, you can take a boat. Right? You're going to eventually get there. You
will get there on a boat.
One day. Or you can just go on a jet plane and get there in 15 hours.
Sure.
The CO2LIFT is a jet plane. It's the fastest way to get the results that you're looking for.
Very, very, very cool. All right. So basically, I'm going to kind of sum it up. Just if you haven't tried the V, and if you want a more intense experience, let's say you are having painful sex, etc., something like that.
Yes.
You want to jump in and do 5 and 5.
Yes.
So Monday, Tuesday, Wednesday, Thursday, Friday, take the weekend off, and then another 5. That's what you did, and you're like, that was the game changer.
Yes.
And then after that, once a month.
Correct. And that's what the study showed.
Okay.
And I know we didn't mention this too, Jacqueline, but lichen sclerosus is another one. We have great histology on that. Great. So many women. I think the number right now is 15% of women in the United States experience, and that's what's diagnosed. Lichen sclerosus.
And can you say what it is?
Okay, so I'm not a doctor, so I'm able to, in my layman's term, from what I understand, it's like almost like psoriasis, eczema of that area. Exactly. It looks that way. Yeah. Sometimes you can have fibrous tissue that closes the opening. It can be very painful. Sometimes sex is impossible. Or difficult, depending on the level of lichen you have. But we have seen really fantastic results with lichen and biopsied lichen, and then we have pictures. So, and I'll send that to you, whatever you want to share with your definitely. Audience. I think it's important. So that is definitely a statistic that we want to talk about. Also, too, I think, what is a statistic on this, Jacqueline? You maybe help me on this, but what they say, only 30% of women experience orgasms during sex. I think that was the number.
That's high. Basically, my numbers were in the 20s.
Okay.
Yeah.
So, and I think we need to address that because it's, we were created with a clitoris for the sole purpose of pleasure. And so I think that first, a woman needs to really understand the benefit of sex. I mean, oxytocin that's produced, what it's doing for your skin, what it's doing for your emotional well-being, what it's doing for your immune system. So it's definitely a benefit for having orgasmic sex. Okay, so
It is a whole body workout.
You feel better. You less tension. You know you have more patience. You know what I'm saying? So
Your hands are a lot warmer.
yes.
Yeah.
So
that works. It really does. Right? All the circulation.
So that's the benefit.
Yeah.
And then we need to understand our anatomy. We need to understand that the vulva is a very important part. We need to understand that the clitoris, that erectile tissue is underneath, that needs to have blood flow.
Yeah.
And how we get blood flow, well, this is a great way to get it. And then we need to think about our tissue inside and think about your hormones. I think those things will help, because every woman can get an orgasm, and then it's about the mind, our mindset. So once we understand the importance of it, once we have that blood flow that's connecting, through our spinal cord to our brain, we will feel better, we'll enjoy it better. And
I agree. It really is tapping into the mind-body connection.
Yes.
Because this, even just doing this, this is very self-care.
Yes.
Right? Just to even take the time, put this on. And I know I was at one point where I was thinking, self-care just seems very frivolous. I should be doing things that seem more important. But then I've gotten to a place where I'm like, you know what? We have to feed ourselves if we want to feed others.
Yes.
And the better I take care of myself, the better I can take care of my daughter. And that's what really makes me happy, is to be able to take care of other people. So I think we really have to take the time to do it.
Amen.
And we shouldn't forget the skin that is within us.
Yes.
It's really important. Something, too, that we talked about before we started taping, and you have this incredible testimonial that I'd love to share as well, from a woman who had cancer.
Yes.
And I shared with you that I've got people very close to me in my life that are cancer survivors, and they, as recommended by their doctors, are not doing any kind of hormones. They're also staying away from different lasers that are available to some people because their doctors have said, no, don't go near anything. And the testimonial that you shared with me, that woman was a cancer survivor. And this is totally safe.
Yes. She came up, we met her last year, and I forwarded the testimony. It's actually on our Instagram, but she came yesterday, and she just said thank you. She's been, I think, a cancer survivor for 15 years, but for the last 3 years, and then getting into menopause, including that, she hadn't had sex with her husband. And so she tried the V, and she said from the first one, she felt a difference. From the first one, and she's been doing them, and her sex life has improved, her marriage has improved. Yeah. It's very, very satisfying to hear these stories, and I hear them all the time. So in fact, one of our best reps, Rebecca Fisher, she's in LA. She had come to us because of that. She's a young woman. I think she had got cancer. And Rebecca, if I'm saying this correctly, please forgive me, but I think she was like 48 when she got it, or maybe it's 47. Anyway, she chemo, her hair fell. She was newly married, just newly had a baby, and her sex was impossible for her. Her tissue was so sick, she would bleed. Went to her gynecologist, and they recommended the CO2LIFT, and it totally changed her life. Changed her life. So she wanted to meet me, and we met, and then she started working for CO2LIFT, and she's very passionate. You can imagine someone who has experienced it for themselves, and I think that's why I feel this way myself. I love, obviously, the face. For me, your image is important, how you feel, looking the best way that you can, in a simple way, and I'm a very simple person. I love that we're doing that. The V, though, has a special place for me because I feel like that is about my connection with myself and a connection with my husband. That part of my life, if I didn't have it, we wouldn't have the type of marriage we have. I think intimacy, and even though intimacy is not just about sexual intercourse, it's a big part of intimacy.
It is a big part. There's a reason why if you go to a marriage counselor, pretty much within their first 3 questions is going to be, when was the last time you had sex? Yes. Exactly. It's an important part.
Yes, and whether you're actually having penetrative sex or not, you still need all of that area. It has sensitivity. It is erectile tissue there, so you want to activate it. And I think that yes, you can do, and nitric oxide is good. All those things are good. I'm not knocking any of those things. And the more you do, the best. I just know that this is doing it very quickly, and it's keeping you at a simmer. And I think that's important. So you can just be ready, for when that happens.
Yes, and you're not like jumping for, let's say, the lube or the this or that, because you're already being hydrated from the inside.
Right. And even though the lube and the lubrication is one thing, and that's true, you don't need to jump for it, but the sensitivity, in other words, the feelings that you're getting when you're doing it before he even enters you, that feeling is going to happen because blood flow is there. It's like you're warm. You're ready, so
cool.
And even for those, and I speak to women, I'm not in a relationship right now. Well, eventually you will. And it's not just about a relationship. It's about feeling sexy and confident. It's about not having as many infections because, as we get older, we increase in our pH. This is bringing our pH down. So it's also keeping us aware of ourselves. We as women have so little sexual cues. I mean, a man can stand outside in the breeze and it just gets hard, right? Right? I mean, we're in our heads. So we need to relax but if we can have it like ready so that when we're ready to think about it and when we're ready to get sexy, we can be and feel good. I think that's important.
It is important. And I've said this over and over again. And I mentioned it the other day to someone who you probably know, Dr. Suzanne Gilbert-Lenz in Beverly Hills.
Yes. Well, I don't know her well, but I mean, I know who she is.
She's so great.
Yes.
I love her.
Yes.
And we were just talking about the importance of having an actual symbol for different rituals. And so when you said, the face is so great, right? It's your image, it's your outside, it is, who you show the world, here I am. But you said the special place in your heart is for the V, because that's about your own connection with you and also your connection with, with your husband.
Yes.
And taking that time just to do this treatment that we ran out of here and inserted and came back. I'm excited to do this at home, make a ritual out of it. Like I make kind of a bath ritual, which is nice. It's like about connecting. I light candles. I leave my phone outside of the room, or I watch Love Island, to be honest. But it is about just connecting with yourself. Yeah. And so I look forward to using this as that ritual.
So either you can go to your doctor's office and you can ask them about it, or you can go to the website, CO2LIFT.com. And Jacqueline is going to have a code that you can use. I guess we'll name it, what do you want to name it?
Let's name it Clitorology.
Clitorology 15. And for that, you get 15% off the website. So we'll create that and have that over for you today. Yes. And you can get all the products and try it. And I'm always available. I love talking about this. So feel free to DM me and just ask me any questions. This is really my passion, and it changed my life. I've seen so many of my good friends who this has changed theirs, and I know it will help you as well.
I'm super excited about it. I really am. I'm excited about doing it weekly.
Yes.
And then with the face.
Yes.
Weekly also?
So you want to do, so the study is really 3 the first week. Yeah. 2, then 1. So 6. Great. You want to get 6 in. Perfect. Try and get 6 within the first month.
I just wanted to get that clarified. Yes. Because I was a little unsure about it. Okay. But you told me before. So 3, then 2, then 1.
Or 3, 1, 1. Just as long as you do the 6 within the first month.
Got it. Okay.
And then maintain with monthly.
Okay.
Right? Yeah. And then the V, it's 5 or 10, depending on where you are.
Yeah.
Within the first 2 weeks.
Yep.
And then monthly to maintain.
Okay.
Yeah.
Super fun. Super fun. Oh, how do we take this off?
Okay,
what do
so
we do?
Let me do. So I'm going to just remove this.
And then I'll just be wearing these gloves for the rest of time.
Just remove this from you.
Okay.
And then you can see how it just comes off.
Yeah.
Right?
Okay.
Mm-hmm. Yeah.
Okay, here we go.
There, and then you just take this off. Okay. And then, of course, I didn't have a
And then I would like
wash it off.
Okay.
And then just wipe it off and you're good to go.
And then I'm good to go?
Yeah, just wash it.
Oh! Yeah. Why do they look so good? Okay, seriously though?
And Jacqueline, you're going to notice tomorrow, and then the next day, it's just going to stay. So it's not just in this. And obviously, she has a little bit of gel on her thing, but once she takes it off,
okay, so generally my hands look a little blue. I am not kidding. They go like a grayish blue. This looks like a peachy, this is good for me. Like, I don't know what your baseline is, but this is better than mine. Much better. Like, I generally look at my hands and I'm like, I'm 9,000 years old.
I know, same with mine.
And then of course I'm like, thank God for my very young vagina. but my hands tell the real story. No, this is awesome. Okay, so what we would do, and then I just wash this off, and
wash
there we
it
go.
off, and you're good.